It's that time of year to decide on your health care plan. And today, Pete Clarkson, the CEO for United Healthcare, Medicare and Retirement in North and Central Florida, is here to discuss the Medicare Advantage. Hello, Pete. Welcome to the show.
Oh, thanks for having me.
Well, I will say I'm glad we're talking about this because there's so much buzz about healthcare and there's so many questions. It can be so overwhelming and confusing. So let's kind of start at the beginning. Let's start talking enrollment. We're entering that enrollment time. Why is it so crucial to pay attention to this time?
Well, Medicare enrollment started October 15th and it ends December 7th. And the reason that it's so important is because it's the one time when most people can make changes to their insurance for the coming year.
Okay.
So healthcare is really personal. It's not one size fits all. So it's really important to explore your options because the decisions you make can have an impact both on your health as well as your wallet for 2018. So be informed, be prepared, and you'll make some great decisions.
Well, I'm curious. Say I'm already enrolled and I've got my plan and I really don't know a lot about it. Why do I want to consider making changes? What are some examples of changes that can be made that will benefit people?
Well, you can make changes in carriers, you can make changes in coverage, and the reason that this is so important is because we did a survey this year and found that almost 40% of our beneficiaries find the Medicare program to be confusing, and there are a few tips that we can help with that will help kind of navigate those waters and make it a little easier to understand.
Well, you know I got to go there, Pete, since you threw out that you've got tips for us. What are some?
So I always tell folks to get personal about your health care. Ask yourself some tough questions. And think about three things. Think about quality, think about care, and think about your choices. So first with choices, think about, has my health changed in the past year? Am I getting the most out of my benefits? Does this still fit within my budget? When you think about quality of care, think about, is my doctor, specialists, hospitals still in the network? Are my prescriptions covered? Can I still use the same pharmacies? And when you think about experience, are you getting the most out of your health care coverage today? Could you be saving money? Are there some programs that you're interested in that you don't have today? And if you answer those questions, you're going to make better, more informed decisions about your health care.
Well, you kind of just touched on programs, and I know there's a few buzzwords that I even keep hearing as I'm, paying attention to health care. Medicare Advantage, what is driving that growth that we're seeing these days?
So Medicare Advantage has grown nearly 50% over the last 5 years, and the reason it's so appealing is because of the value and simplicity it offers. You get to combine Medicare's Part A and B into one coverage. You get more benefits than you get on original Medicare. Most Medicare Advantage plans cover prescription drug benefits, and there are cost limitations, so it's more predictable so you can manage your healthcare budget more effectively.
Say someone's watching at home right now and they have, some individual questions or ways that they just want to make sure they're getting the best for themselves and maybe want to talk to somebody. What are some resources that you can share for people? So
if folks would like to get more information about United Healthcare plans, they can visit uhcmedicareplans.com or they can contact 1-800-MEDICARE 24 hours a day, 7 days a week.
Okay. Again, anything else that you want people at home to know about? Because it's just so in the headlines right now. And if people even aren't on Medicare yet, it's something we all think about for the future.
Well, now is the time to do your homework. Now is the time to make your selections. Now is the time to set yourself up for better health care, better outcomes, and a better healthcare experience for 2018.
I can just tell by talking with you, you really care. You are really passionate about helping people out there.
I love the Medicare Advantage programs and love to help folks. So we're here to help.
I will say, and again, navigate through some tricky waters with a lot of questions. But Pete, thank you for coming in and doing this today.
Oh, thanks for having us.
We appreciate it. And now he already touched on it, but if you want more information, we'll contact United Healthcare Medicare plans at the number and web address on the screen. There's the information right now. And again, open enrollment does end December 7th. Thank you again for your time.